This is Sandy Marrero with Western Marketing. I wanted to thank everyone that has joined in to participate on this webinar with Pivot Health. With us, we have today Betty Perez, Account Executive for Pivot Health Insurance. And we have a very good and exciting product that we want to share with you today. Without any further ado, go ahead, Deli.
Oh, okay. Thank you so much, Sandy. I appreciate it. Good morning, everyone, and thank you for joining today. So I'm looking forward to sharing with you a new product that we rolled out last week. So aside from, for those of you who are familiar with Pivot Health, you know that our short-term products are our niche product, but we have a new fixed benefit plan that I'm excited to share with you today. So please make sure you stay on so that you can hear more details about our new anchor plan. But I do want to share with you all the sales opportunities available to you as an agent with the Pivot Health portfolio of products. I want to first give you a little bit of background on Pivot Health. For those of you who are new to Pivot, Pivot Health is not an insurance carrier. We are actually a product development, marketing, and management company. So we design the products and bring them to market. We launched in 2016. You'll see that my email address, my domain is healthcare.com, as in 2018. We were acquired by healthcare.com, which is a leading insurtech company that provides data-driven solutions using proprietary algorithms. Pivot is rated excellent by customers based on Trustpilot reviews. Just to give you a little bit of background so you understand, you may see some other names when working with Pivot Health. So Pivot Health has insurance benefit administrators, formerly known as Allied National. They are our third-party administrator, so they actually service our plans, our claims, and they also handle our commissions. Insurance carriers, we have partners that actually insure the plans that we market. Again, like I mentioned, Pivot Health is not the insurance company. We have insurance companies that actually underwrite our products. And then we have networks and PBMs for the plans that offer coverage through networks, through PPO networks, and prescription coverage. So the product suite that Pivot Health offers today. We do specialize in the under 65 market, but I do want to tell you that our new fixed benefit plan can be kept through the age of 74. And our dental and vision plan is also available to clients up to the age of 100 if they decide to keep the benefits. So we have our short-term medical products. These are going to be our niche products, and those do go up to the age of 64 and 11 months of age. As I mentioned, our fixed benefit plan, our new anchor plan, can be kept to the age of 74. Our dental and vision is also available beyond the age of 65, so long as they continue to pay the premiums. And then we have a supplemental, which is our only guaranteed issue plan, and that is also available through the age of 64 and 11 months of age. So I'm going to just go through the highlights of our short-term medical products, because we do feel that our products are unique. I personally have been in the short-term market for over 20 years, and Pivot Health's products definitely offer a large array of plan options for your clients. And we're very excited that we recently added on free and unlimited telemedicine to all of our short-term plans. And why did we do this? Because we saw with the pandemic how the increase of telemedicine transpired over the last 18 months. So with that said, our plans offer coverage within 24 hours or as far out as 60 days. So you can sign up a client today and they can have coverage starting October 1st. We have extended duration options that allow your clients to have, in some states and products, up to 2 364-day policies, and others offer 3 by 364-day policies. We have access to some of the largest national networks on some of our plans. We also have open access plans, and these plans allow your client to have the freedom of choice to use whatever provider or facility they choose. And with those plans, we use reference-based pricing to help reduce their out-of-pocket expenses. Eligibility ages for our plans are 6 months through 64 and 11 months of age. And again, keep in mind, this is specific to the short-term plans. We offer child or children-only policies, and the child can be as young as 6 months of age to be on a plan. Our short-term plans also offer coverage to high school and college athletes. And all of the carriers that underwrite our short-term plans are A-rated companies. So I mentioned the extended durations. For those of you who are not familiar with selling short-term medical plans, so we have plans that offer up to 2 years or 2 by 364-day coverage periods, and others offer 3 by 364-day. And this will vary by the carrier and also by the states that allow the extended durations. There's no new application in between each coverage period when they sign up for an extended duration. When the first policy ends, the next one starts automatically. So one policy will end at midnight, the next one will automatically start at 12:01 a.m. This allows for no gap in coverage, there's no new underwriting, and no new waiting periods applied to the subsequent policies. Now, keep in mind the copays and coverage maximums do start over again. One of the benefits of doing an extended duration, if the insured develops a condition while on the coverage, that condition would not be considered pre-existing for the subsequent policies. Deductibles and coinsurance maximums also start over with each new coverage period, and this extended duration option must be selected at the time of enrollment. And I will be sharing the process to quote and enroll a client and how you would do that. We currently have 5 different plan designs for short-term plans. We have our core plans that are a passive PPO plan. Our classic plans are essentially the plans that Pivot Health rolled out with back in 2016. These are going to be all open access plans with no network restrictions. We have our newest short-term plans that are a little over a year old. These are our Epic plans, which offer more wellness and preventive coverage and 100% coinsurance. We have our Quantum plans. Quantum plans utilize a Cigna PPO network for the coverage and are very rich in benefits. And then we have the Bridge to Medicare plan. That's a plan that we designed specifically for that age band between 60 and 64 and 11 months of age. And this is the only plan that offers an automatic 3 by 364-day coverage period. So first I'm going to go over just the highlights of the core plans. So the core plans are plans that we see people that are looking for everyday expenses. A lot of child or children-only policies on these plans. The most popular members on these plans are under the age of 35. These plans offer doctor office visit copays, which are limited to 3 visits per insured per coverage period. They do offer low deductibles. There's prescription drug benefits. There's going to be a Core 1000 plan and a Core 2000 plan. The Core 2000 plan will offer the prescription coverage with copays. With these plans, they have access to the First Health Network. I mentioned it is a passive PPO plan, which means if they go out of network, the benefits will remain the same, and we will use reference-based pricing to help reprice those out-of-pocket expenses. These plans do have limited or fixed hospitalization benefits, and I want you to make sure that you do take note of those limitations, and this is what keeps the premiums low on these plans. And these plans have 3 by 364-day extended durations available based on the state that you're selling it in. These plans are underwritten by Companion Life, and Companion Life does allow the 3 by 364 durations. So any of the plans underwritten by Companion Life, if you're offering it in a state that allows the extended duration, you would have the option to sell them a 3 by 364-day coverage period. And again, free and unlimited telemedicine, which includes dermatology, on all our short-term plans. Then we have the classic plans. As I mentioned, the classic plans were the original plans that Pivot Health rolled out with back in 2016. These are open access plans, so there's no network restriction. The majority of the people that we see enrolled on these plans are those looking for an alternative to an ACA plan. If they don't qualify for a subsidy and they're healthy, we see a lot of people over the age of 60 just trying to keep themselves covered up until Medicare eligibility age. You have options on these plans, and there's going to be 4 plan names under the classic category. You're going to have your standard, economy, choice, and deluxe plans. You have 2 plans that are going to offer office visit copays. You're going to have 2 plans that are going to offer prescription coverage, including copays. That's going to be your deluxe and your standard plan. Again, these are open access plans, which allow your client to use whatever provider and facility they choose. And we will use reference-based pricing to help with the out-of-pocket expenses. And because these plans are underwritten by Companion Life, you will be able to offer a 3x364-day coverage period in the states that it is allowed. And of course, the free and unlimited telemedicine included. I keep mentioning this reference-based pricing. So for those of you who are not familiar with reference-based pricing, essentially what reference-based pricing is, it means that Pivot will allow and pay providers based on the Medicare allowable charges for a service, or usual and customary. So for a physician, we will allow up to 125% of Medicare allowable. For a facility, we will allow up to 150% of Medicare allowable. Now, the client does not have to do anything special. They will receive a ID card when they enroll in a short-term plan. On the ID card, they'll have the phone number for the benefit verification department so that the provider can call in and verify the benefits. And it also includes the instructions on how to submit a claim. So the provider will have all that information at the time that the client checks in. The provider submits the claim to IBA, or insurance benefit administrators, for processing. The claims are then repriced according to the percentage of Medicare allowable. The payment is made to the provider based on those discounts. We see on average about a 68% discount from the retail charges with reference-based pricing. The member will receive an EOB, or an explanation of benefits, that will show the discount that was taken and their responsibility. And the balance bill protection. This essentially means that the member will not be responsible for a balance bill due to the discount that was taken. So if the client does happen to receive a balance bill from the provider or the facility, they have the right to send that bill over to insurance benefit administrators. We have a team that will go back and renegotiate with that provider. And if they can't come to terms, we will pay that balance bill on behalf of the insured. Just a quick example of how reference-based pricing would work. In this example, we have a 59-year-old female in Nebraska who required an MRI. The bill came into insurance benefit administrators at $1,060. The Medicare allowable in this area for this service was $222.72. The calculation was done at 150% for that service. So we're going to allow $334.08. If this client had already met her deductible and was just meeting her coinsurance, which would have been 20%, she would have been responsible for $66.81. If she'd not yet met her deductible, then of course she would have been responsible for the full $334.08. But just to give you an idea, with this example, you see that this is well over a 50% discount from what would have been billed in the case that this client had not had this coverage in force at the time that she needed this MRI. Our EPIC plans. The EPIC plans, as I mentioned, were the newest plans that we rolled out with. These plans are underwritten by North River Insurance Company. They are an affiliate of Crum and Forster. Of course, they are A-rated. And these plans, based on the state where extended durations are permitted, would allow you to sell a 2 by 364-day extended duration option, unlike with Companion Life that will allow 3 by 364. So we're seeing on these plans a lot of young families, self-employed, people with children. Why? Because there are wellness benefits included in these plans. So for example, childhood immunizations, mammograms, PSA testing, all those services are actually covered at 100%, not subject to deductible. These plans are 100% coinsurance plans. So what does that mean? That their max out of pocket is going to be whatever deductible they select on this plan. The lowest deductible available on the Epic plans is going to be a $5,000 deductible. So that could be, if that's the deductible they select, that would be their max out of pocket before the plan kicks in and covers 100%. With the Epic plans, please take note, there's going to be 2 plan designs. There's the Epic PPO plan. That will utilize a Cigna network. And if there's an Epic base plan that is going to be an open access plan, it will not utilize the Cigna network, and it will use reference-based pricing to help with their out-of-pocket expenses. There's an optional prescription drug benefit that needs to be selected. So you have to make sure that when the client is shopping for a plan, if they are looking for prescription coverage, that they select the plan that includes the prescription coverage. There's an optional $5,000 or $10,000 supplemental accident rider. Also, this must be selected at the time of enrollment. And essentially, what that supplemental accident rider would cover, it would cover up to that dollar amount that they selected for expenses incurred due to a covered accident if the insured required medical attention within 72 hours of the accident. The telemedicine, of course, is free and unlimited, and it also includes the dermatology. Our quantum plans. As I mentioned, the quantum plans utilize a Cigna network. So both plans, there's going to be a quantum PPO high deductible plan and a quantum PPO copay plan. These are very rich in benefits. So the copay plans offer office visit copays, as well as prescription drug copays. There are 100% coinsurance plans available with the quantum if they select a $10,000 deductible. Now with the quantum plans, $10,000 is going to be their max out of pocket, whether they select a lower deductible with a coinsurance or they select a $10,000 deductible, that would be their max out of pocket. These plans do offer a preventive office visit benefit that'll cover up to $250 towards a preventive or a wellness visit. There are RX benefits included, supplemental accident benefit that covers the plan deductible for each insured per coverage period. So if they selected a $10,000 deductible and they had an accident, and it would cover up to $10,000 of expenses incurred due to that covered accident if they required medical attention within 72 hours. So this is included in the quantum, where the supplemental accident rider with the Epic plan is an option that needs to be selected at the time of enrollment. Again, the quantum plans utilize a Cigna PPO network. If they go out of network, we will use reference-based pricing for covered services. And these plans, of course, include also the telemedicine, free and unlimited. And the quantum plans are underwritten by Companion Life, so you would be able to offer a 3 by 364-day coverage period in the states that allow it. And then we have our Bridge to Medicare plan. The Bridge to Medicare plan is a plan that we designed specifically for that age band between 60 and 64 and 11 months of age. You'll see that if you go to the Bridge to Medicare or pre-Medicare tab on the quoting portal. If you put in a date of birth and the client is under 60, it will not allow you to quote them. Now, you can enroll someone, an applicant that's between 60 and 64 and 11 months of age, and maybe a spouse or dependents that are under that age. These plans are an automatic 3 by 364 day coverage period. Of course, if they enroll at 64, they will not be able to ride out all 3 coverage periods because they will age off at 64 and 11 months of age. So unlike the other short-term plans that are available for this age band as well, you do not have to select the extended duration with the Bridge to Medicare plan. Currently, these plans are available in 9 states. So if you're in a state that is not offering the Bridge to Medicare, make sure that you realize that you can offer any of our short-term plans. These plans are open access plans, so there's no network restriction. Again, that's important for this age band because most of the time these clients will have already established relationships with their providers or their facilities. And we see about a 50% savings with using this alternative versus an ACA plan for this age band. For those of you who sell Medicare, I'm sure that you come across clients all the time when enrolling them in a Medicare plan that may have a spouse that's not yet Medicare eligible and may be left without group or employer coverage. So this would be a great alternative for them. And the Bridge to Medicare plans are also underwritten by Companion Life. This is a little cheat sheet for you because we realized that there were so many plan options available. It gets a little bit confusing. So we came up with 5 different scenarios. More than likely, a potential client that you're working with will fall into one of these categories. So we gave you some starting points as to which plans you may want to consider first for this particular client. This chart, you will find it in your agent resource tab as well as in your quoting portal. Of course, these are just ideas for where you can start, but you're able to offer any plan that would best fit that client's needs and budget. We offer ancillary products, and we offer them standalone and as an add-on. So our Brilliant Dental plan is underwritten by Renaissance Dental. It is a PPO plan. This can be sold as a standalone product or as an add-on to a short-term plan. The eligibility ages for these plans is 18 and up. And when I say up, they can stay on, as I mentioned earlier on, beyond the age of 100, so long as they continue to pay the premium. If you are selling a short-term plan and you are including children as dependents, the children would get the benefits for the dental. Same as if you're selling it as a standalone product. If they're adults, you can include children on the coverage. You just cannot sell it to a child only. There are no waiting periods for benefits on the maximum and essential plan. There is a 6-month wait for basic services on the value plan. You can start coverage any day of the month. If you sell it with a short-term plan, the effective date is going to coincide with whatever date you selected for the short-term plan. Some of the benefits and annual maximums will increase at the beginning of the first 3 coverage periods on the essential and maximum plans. So they are progressive plans. Routine cleanings are paid at 100%. Basic services include the fillings, sealants, and extractions. Major services on the essential and maximum plan include crowns, oral surgery, and implants. With this dental plan, you can add on a vision option. It'll be through Vision Care, and the vision is not available without the dental. Here is a screenshot of the current brochure for the dental plans. So as you see, the essential and the maximum plan do include coverage for major services. If you are including children in these plans, you would probably want to offer the maximum, as that is the only plan that offers orthodontia coverage. This is the vision plan. If you're adding vision on when purchasing a dental, there'll only be one plan option. It is a PPO plan and it is through Vision Care. Our Latitude plan. This is our only guaranteed issue plan, and this plan is it's an accident critical illness accident, death, and dismemberment, and hospital indemnity plan bundled into one. This plan can be sold independently. As a standalone product, you would click on the supplemental tab for the Latitude, or you can also add it as a check the box when selling a short-term plan. And we added this as a check the box because we realized that a lot of times agents were forgetting to offer it to the client to help with their out-of-pocket expenses while meeting deductibles and coinsurance. Now, if you're selling an ACA plan because that's the best fit for this your particular client, you can always add this as a standalone because it will help with their out-of-pocket expenses. And the cash benefits are on these plans are paid directly to the insured to help them reimburse their out-of-pocket expenses. And this is the new Pivot Health Anchor Plan, the fixed benefit medical insurance that I mentioned earlier on. This plan is hot off the press. It literally rolled out last Monday on September 20th. So just want to go over some of the highlights for the new Anchor Plan. So the Anchor Plan, the benefits are based off of a calendar year, not a coverage period. The blended benefits, what does that mean? So most fixed benefit plans pay benefits for illness and a separate, often different benefit for an injury. They typically have per day limits on each. So what we've done, our benefits are for sickness or injury, and they have the same benefits. We offer office visits, 6 per calendar year. There's a benefit for injection. This could include flu shots, immunizations, and vaccines. Something that we hadn't seen was oral chemotherapy and an outpatient radiation benefit included. All the plans include discount card through Surpass RX. Select and Maximum have a generic and brand benefit. And please note when you share this with a client, the RX benefit is not a copay, that is a reimbursement. So anytime they use the benefit for prescriptions, they have to send the receipt in for the prescription to insurance benefit administrators for reimbursement. And something that I want to make sure everyone is aware of, the discount card through Surpass also offers discounts on over-the-counter drugs, so not just prescription drugs. The hospitalization benefit on these plans also increases in year 2 on the Select plan, and it goes up from year 2 and year 3 on the Maximum plan. Sorry. Also, surgery benefits is a percentage of RVRVs. So what does this mean? It's similar to the reference-based pricing that I shared with you for the short-term plans. For the value plan, we are paying the benefit of Medicare allowable. On the Select plan, we'll pay 25% above the Medicare allowable. And on the Maximum plan, we're going to pay 50% above the Medicare allowable. So this does work differently, as I mentioned, than with the short-term plan. So with the Anchor plan, this is the amount, the dollar amount benefit that the plan is going to pay. The claim is not going to get repriced. Also, just so that you know, Louisiana, Michigan, and New Mexico, these RVRVs are not available. So the benefit amount is going to be a fixed amount. So for the value plan, it's going to be $1,000. Select plan, it's going to be $1,250. And the Maximum plan is going to be $1,500. Something that we have not seen often with these type of plans is an accidental death benefit included on these plans. And our plan, the Anchor, has no lifetime maximum, where most other fixed indemnity products have lifetime maximums on them. The Anchor plan has Point Health. So for the Anchor plans, we partnered with Point Health. Point Health is a patient advocacy service. So what does that mean to your client? Point Health offers healthcare navigation support through their new mobile app and through their patient advocacy customer care team and bill negotiation services. This is important for your clients because a lot of times it's time consuming and they just don't know where to begin when it comes to filing claims on these type of plans. These resources empower the member to be a healthcare consumer, shopping for the best healthcare that fits their needs and their budget. So, patient advocacy, some of the services that would be provided: search for hospitals, prescription, surgery centers, and medical facilities for non-emergency procedures that fit your needs. Compare estimated costs of outpatient procedures, so it's doing the shopping for them. Transfer of medical records that are a lot of times required by insurance. Contact and schedule appointments on behalf of the insured. Also offers bill negotiation. So Point Health bill negotiators can step in on behalf of the client to help lower their medical bills. And when they need help, contact the bill negotiator, give them their bill information, and they can take it from there for them. When coming to quoting and enrolling a client in a short-term plan, if you're not yet contracted with Pivot Health, you will get a welcome email that will provide you with your Pivot Health number. And remember, you're going to need this to enroll, to be able to go into the quoting portal to sell any of the products, including the anchor. You go to www.pivothealth.com, go to the login tab, go for agents. You'll use your Pivot agent or writing number as your user ID to get registered into your portal. Once you're in the portal, you'll have your agent resource tab along the left-hand side. In here, you're going to find brochures, marketing material, training schedules, also PPO network lookup links, as well as prescription formularies. In the middle of the page, you'll see your book of business. So once you start selling plans, you'll be able to access your client's information in your book of business. And then if you want to do a quote, you would start here with get a quote. This example is going to be an example for a short-term plan, but you will see if you go into your quoting portal, there'll be now a fixed benefit insurance, and that's where you would find your anchor plan. You always start by using a zip code. This will allow the system to identify whether or not there are plans and products available for that client in that zip code. Once you put in the zip code, you click on Get Started. On this page, it's going to carry over the zip code. You're going to enter a date of birth, the gender, the first name of the client. Where it says email address, I would leave that blank. That will make the system think that the client is shopping on their own without the assistance of an agent, and will start sending out automated emails. If you plan on emailing a quote, there's going to be a separate section to do that. So I'll be sharing that with you. Of course, if you're adding a spouse or children, you want to make sure that you include that at this point, as that will affect the premium. When it comes to the desired start date, the system is always going to default to tomorrow, the next day. So if we were on the quoting platform live right now, the desired start date would be showing 10/1/2021. If they want a date further out, up to 60 days, you would click on the little calendar and select the date that they're looking for their coverage to begin. And don't worry, the system will not allow you to go beyond the 60-day allowed time frame. When it comes to the durations of the plan, the system's always going to default to the longest duration available in that area. If you are looking for 180 days or less of coverage, make sure that you change it at this point, so as it will affect the premium on the plan. Once you click on Find Plans, the top of the screen is going to show you 3 recommended plans that we have selected, and these are not selected randomly. It has been selected by statistics and marketing analysis that have been done with clients with similar demographic information. And you don't have to select one of these 3 plans. Below this, if we were on the full screen, you would see a show filters, where it's showing high filters right now. because this has already been opened up. This will allow you to select plan benefits that your client is looking for. In this example, we're clicking on plans that include doctor office visit copays. And then once you click on these filters, you'll be able to go into each plan name and make adjustments to deductibles, co-insurance, max out-of-pockets, total policy coverage, and the duration. And keep in mind, if you open up these drop downs, if there is only one choice, the system will not allow you to make any changes. If you want to compare plans, the system will allow you to compare up to 3 short-term plans to send over to a client. And this has already been selected. So as you see, the 3 plans have been chosen and displayed at the bottom that were clicked on. Just so that you know, with our anchor plan, if you go into do a quote today, you won't have the capability of sending the 3 plan designs side by side, but that feature is going to be coming out within the next couple of weeks. So I'll make sure to keep you updated on that, because I know that agents find that very important. So once you click on the add to compare, it'll populate, and you can do this for up to 3 plans. And then once you click on compare plans, it'll take you to the next screen. This is going to display the 3 short-term plans you selected side by side. If you wanted to highlight the differences of the plans, you click on show differences, and it would highlight them in green so that it would stand out. You're able to click on view plan details. They can also download a brochure. And most importantly, you can email this quote to a client. Once you click on email this quote, the system opens up a window. That's where you will populate your client's full name, their email address, and a box will open up so that you can put in personal notes to them. The system will not store the quotes that you sent, but you will get a copy of the email in your inbox. So you'll be able to see exactly what you sent to them. And the links inside the email are static so that they are able to do the things that I've highlighted with the details, download the brochure, and also select the plan, and they can actually start the application process with or without you. If you want to go back to send only one quote, you would go back to quote results, select one plan, click on the view details, and it'll take you to the next page. On this page, this is where you'd still be able to, with this example, we're looking at an EPIC plan. So as I mentioned earlier on, the EPIC plan has that supplemental accident rider. This is the only plan design that has this supplemental accident rider that needs to be added at the time of enrollment. They don't add this on at this point and they enroll in the plan. Unfortunately, we cannot go back and add on the accident rider. This page also allows them to change the number of days of coverage. Here, the extended duration, because it is an EPIC plan underwritten by North River, the maximum coverage period is going to be 2 by 364. Keep in mind, if it was a companion plan, you would be seeing a 3 by 364 day option. As you see at the bottom of the page, here is the check the box to add on the dental and vision, as well as our Latitude plan, that accident critical illness bundled product. Once you've added and clicked in any enhanced products, your summary on the right-hand side is going to update. So it's going to display the total number of days of coverage that you've selected to this point. It's also going to update the premium, the monthly premium expense to the client with the new products that were added on. And then, of course, you can email this quote to the client. Again, it's going to open up that window. You're going to put in the client's full name, their email address, and you can put in a personalized note, and you will receive a copy of the email they received. So for a single quote, this is what the email is going to look like, and you're going to get a copy of this in your inbox. Again, the links inside the email are static. They can view the brochure. They can actually click to view the quote online. or they can actually start the application. Now, keep in mind that with the short-term plans for Pivot Health, our underwriting is simplified. What do I mean by that? Their eligibility is going to be based on how they can answer the application questions. There will be no additional underwriting. So if they can answer no to all the application questions, their policy will automatically be issued. There are some health questions, the look back. This is an example of an EPIC application. So it is a 5-year look back for these conditions that would make them ineligible if they had to answer yes. But a couple of key notes, differences with the pivot plans versus other short-term plans in the market. We do accept type 2 non-insulin dependent diabetics. We also do not ask a tobacco use question. When it comes to height and weight, we only have a weight limitation. So a female cannot be over 250 pounds. A male cannot be over 300 pounds. We also do not ask for a social security number. If the client that you're working with is not a United States citizen, they only have to be able to answer that they have resided within the United States for the prior 12 months. Once they've gone through all the application questions, they would fill in their contact information. On this page, their email address is required. Keep in mind, everything is electronic. They get a welcome email with instructions how to go log into their member portal, as well as utilize our mobile app so they can have their ID card with them on their smartphone. When it comes to payment methods, it's going to be a credit card or an ACH only, and we do not have paper billing options. If at this point of the application process, they need to change the number of days of coverage, they can do so still at this point. They will click on edit, a calendar will open up. They do need to make sure that they click on save if they have changed the number of days of coverage. If not, if they don't click on save, it will revert back to the original dates that were selected on the application. I just wanted to share with you, for those of you that you're selling a 180-day policy, whether it's in a state that limits the coverage to 180 days, or the client has a specific reason for only needing 180 days of coverage, you can offer them a prepay option. The prepay option will offer them roughly a 25% savings on their premium. So that's a big feature. Now, keep in mind that if you're selling a 364-day or an extended duration, you will not see this option at the end of the application process. They can cancel at any time, even if they prepay. We do prorate refunds based on the number of days not used, and also if they do not have any outstanding claims at the time of cancellation. Once they complete the application process, they have to go through the questions and make sure that they agree to all the disclosures on the plan. They do have a 10-day free look period where they can cancel and get a full refund, including their application fee. There's no paper application to sign. It's all electronic, so all they need to do is click and sign, and then they will get their welcome email. I wanted to share with you with the new Anchor plan, we are offering a bonus. This started last Monday when we rolled out the product. So as you see here, it's a great opportunity to sell this plan and get a bonus as well. And I'll be more than happy to share the bonus flyer with you with all the details. You can either contact myself or Sandy, and he'll be able to share it with you as well. Our Ready, Set, Right bonus is for new agents. Unfortunately, this one is going to be ending today, and I don't have the new bonuses for the fourth quarter of the year, but we will be rolling those out as we do offer bonuses quarterly. This is a Captivate bonus. This is going to be wrapping up today as well. But again, I will be sure to share the new bonuses once we get those flyers out, and those would go into effect starting tomorrow through the balance of the year. Here's my contact information. Please take note of that in case you need to contact me for any questions. If Sandy's not available, I'll be more than happy to assist. And Sandy, I'm going to turn it over to you and see if there's any questions or comments that I need to address for.
Well, thank you very much, Lady. It was a very nice presentation. I appreciate it.
Thank you.
I do have two questions for you.
Okay.
And it's very important because people have to understand this plan is a game changer. This Anchor product is a very great game changer. The question is the issue ages for that. I just ran a quote for a 67-year-old female.
Yeah.
And it is available for those people who are unable to get into a Part B Medicare supplement insurance. If they have just Part A or just Part B, you can sell this product as a standalone product. Is that correct?
Yes, sir. That is correct. So long as they don't have a Medicare Advantage plan in force or any Med Sup plans, they can keep this till they're 74 years of age.
Great.
So it's 18 to 74 years of age.
Great. So this is a great opportunity. The pricing is not that bad at all, and this product is very rich in benefit. This product has a really great network with the First Health, and I believe that this is a game changer for most of all of the agents that are in the system with us today. Second question I have for you is state availability. Is it available in most of all the states, or which states are not? Are you just?
So we rolled it out in 19 states. Okay, so it's available in Arkansas, Arizona, Delaware, Hawaii, Iowa, Illinois, Missouri, Mississippi, Montana, Nebraska, Nevada, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, Wisconsin, West Virginia, and Wyoming. And we have another handful of states that should be available within the next 30 days.
Please keep us up to date on those, because I like to have Florida, Oregon, Idaho, and Utah in there. Okay. If you think that they are going to be in better on that, but please keep us updated on that. I will let you go. If we have any more questions, I'm going to have most of the agents reach out to me or send you an email, and then we can answer those questions. And then again, thank you very much for your time, and we'll be in touch. This webinar has been ended. Thank you.
Thank you so much.